My name's Sam. I'm a doctor and Chief Clinical Information Officer at Whittington Health in North London. I'm here today to meet Adam and Chris, who are the Chief Clinical Information Officers at University Hospital Bristol, to learn about the Trust's Global Digital Exemplar Programme. Well, what I'd love to learn about today is, as a fast follower for Whittington Health, it's understanding what the challenges are of putting in IT systems in the health space, and then how did you overcome those challenges?
There was a small fire in the oncology centre which was closed at 2 o'clock in the morning, and by the morning all our patients were scattered around the hospital after having been on one ward. So the IT department, along with a couple of the registrars, got working on Careflow straight away. Within an hour or two we had people running on Careflow on phones, iPads, desktop. We knew where our patients were in the trust. We could hand over on Careflow, so it's like a virtual ward on your phone. And we therefore knew exactly what was going on with patients. When I did my ward round, I could tell where my patients were, what was going on with them, and what the juniors was talking about with them, and I could message, and it could happen from anywhere. So it was a fantastic example of how quickly it can be rolled out in a situation and prove really useful.
And also between organisations. So we're focusing on handing over between teams and within teams within our large acute trust, but we're very aware that patients' journeys don't just exist in an acute hospital, and that when we can use Careflow to communicate with other community providers, then we'll really be realising some of the benefits.
Yeah, lovely to meet you, Sarah. So as a ward sister, how did you find the implementation of Careflow Vitals, and what were the lessons you learned from it?
So we were really lucky to be the pilot ward for the EOB system, and the worries that we had initially were about rolling things out in a system that was new to us, and we'd used paper charts for years, and how that would affect our staff and how difficult that would be. We were actually really lucky to get a lot of support from the IT system people. My concerns were that it was a big change, that we were going over to electronic observations rather than paper observations, which is something that we've done sort of ever since any of us qualified, and getting staff to embrace that change, because sometimes that can be quite tricky.
One of the things we're interested about is, from a patient's perspective, how you found the transition from seeing staff using paper to now really using mobile devices, and what your feelings were about it initially, and how you find it now.
It was weird at first because I was like, oh, I've got their phone out, and then as soon as they explained, I was like, oh, okay, that makes more sense, and it seems a lot quicker.
Yeah.
Yeah, so they could just come in, they do it, and it just seems more simple. Usually they tell you what they're doing anyway, but because it's a new thing, and because I'm here so often, I like to know what's going on.
Yeah, absolutely. That's great.
So, like, a piece of paper could go missing, for example. Can't go missing because it goes straight onto like a database, so it's simple, and everyone can get onto it. So.
Okay, so John, you're the charge nurse on CCU here at the BHI, and you've been tasked with rolling out EPMA, and Sam's very interested to find out how you think it's been going and what some of the challenges are.
Yeah, so we implemented it in December last year, and prior to the implementation we had a lot of training. We had a very good assessment about the technology needs for what we had on the ward, and also actually when EPMA was rolled out, we had a lot of support both from System C and the IT department here at UH Bristol.
And what did you find were actually the main challenges that you faced when doing this implementation?
I think the main challenge was getting the switch over from paper to electronic prescribing, having dual running of people on both charts at the same time, and also having an influx of patients coming in with paper charts and having to get those transcribed.
And in terms of benefits that you're now seeing in cardiology?
I think in terms of benefits, it clarifies a lot of the prescription issues we've had. It means that you can meet your requirements in terms of antibiotic guidelines. No issues with lost charts, don't have to rewrite drug charts, smoother TTO prescription completion.
And so if you were to give some key lessons learnt from this process that you'd like to share with other trusts that might be considering putting an EPMA in, what would those be?
I think you need to pick the area very carefully. You need to make sure that you're in an area that's relatively self-contained. We started it in one ward. We demonstrated that it works, and very rapidly ahead of schedule we rolled it out to the entire department. So we had, instead of just one cardiology ward, we had the whole of cardiology up on EPMA.
Well, first of all, I'm really excited for Whittington Health to be implementing these different System C products. The main messages for me are one about strong clinical leadership. I think it's vitally important, and I've seen that here, that every project has a strong clinical team around it, and that's really important when it comes to the implementation phase and then trying to reap the benefits out of the project. Secondly, the importance of how you pick your pilot site. I think we saw that in the EPMA project. And then finally, it's about how the trust communicates to patients about how we're implementing these different products and what they actually mean for staff as well as patients.
Well, it's been good to have you, Sam, and it's clear that we're working together really well across two really quite different organisations. And I think we've also got a lot to learn from you, particularly around how we can move some of the value of the new products out into the community, not only for patients so that their information is tied together in one place, but also for clinicians here to make their care better and safer. So thanks very much for coming, and we look forward to working with you as we go forward.
Brilliant. Thank you very much, Chris.